Welcome to part 5 of my presentation, An Introduction to Pharmacare, Drug Prescribing, and Working with Pharmacists in BC. In this video, we're going to talk about the Provincial Academic Detailing Service and accessing antibiograms. All healthcare professionals need to look closely at their relationship with the pharmaceutical drug industry and pharmaceutical drug reps. Some view pharmaceutical drug reps as a source of education, but consider this. The information that drug reps provide may be biased, with little mention of the drug's safety and side effects. The studies they present often do not compare the effectiveness of their drug to the drugs of choice and may not be evidence-based. Also, some drug reps may even promote off-label use. Some may view the pharmaceutical drug reps as a source of drug samples, but before providing a drug sample to your patient, it's worthwhile considering these things. When a patient receives a drug sample, that drug is not entered into the patient's medication record on PharmaNet. I suggest encouraging your patient to visit their pharmacy and ask them to enter the drug sample into their PharmaNet record. Consider the cost to the patient when the samples run out. Very often, these samples are for newer and more expensive medications that may not be covered by Pharmacare or their drug plan. Again, you can direct your patient to visit their pharmacy to receive a price quote. Finally, when you give a drug sample to a patient, please check the expiration dates. There have been numerous incidents when a patient has been taking a drug sample that has long expired. As an alternative to the education that pharmaceutical drug reps provide, I suggest accessing the Provincial Academic Detailing Service. The PAD service is funded by the Ministry of Health's Pharmaceutical, Laboratory, and Blood Services Division. This funding is provided to BC's regional health authorities, enabling the service to be available free of charge to physicians and other healthcare professionals. The sessions are provided by trained pharmacists. Academic detailing sessions provide objective, balanced, evidence-informed drug information on the best prescribing practices. This is the Provincial Academic Detailing Service website, where you can find current information about their available programs. These are the current PAD topics at the time this presentation was created. Each topic is accredited for up to 1.0 Main Pro Plus credits. Please refer to the PAD service website for the most up-to-date information on drug therapy topics and accreditation expiry dates. PAD sessions are usually face-to-face sessions for individuals or groups. However, during the COVID-19 pandemic, PAD is providing virtual detailing sessions via individual web conference or teleconference only. Each PAD session takes about 30 minutes, and to schedule an appointment, send them an email. The data for an antibiogram is usually generated from patient specimens, either bodily fluids or tissues that are sent to the laboratory for culture and sensitivity. After the lab has performed their analysis, they collate the data and create a summary table showing the percent of bacterial pathogen species that are susceptible to various antibiotics. The purpose of an antibiogram is to identify the most effective antibiotics to empirically treat infections based on local susceptibility patterns. Antibiograms can be region-specific. For example, you can see antibiograms for Lower Mainland, Vancouver Island, or the interior. They can also be institution-specific or even ward-specific. You could see an antibiogram for a bacteria that's isolated from an ICU ward. Do Bugs Need Drugs is an antimicrobial stewardship program that emphasizes public education and working with community-based healthcare professionals. The healthcare professional section of the website includes some very useful information. There's an antimicrobial prescribing guide, clinical practice guidelines, and links to online antibiograms created by Life Labs and Interior Health. Another way to access online antibiograms is to go directly to the healthcare providers section of the Life Labs website.
At the bottom of this page, under British Columbia, you'll find links to outpatient community antibiograms for the Lower Mainland and for Vancouver Island.
This is the Life Lab's Lower Mainland Antibiogram for 2021. They've organized the information into three main sections: respiratory tract pathogens, which are isolated from sputum, skin and soft tissue pathogens, and urinary tract pathogens.
Let's take a closer look at the respiratory tract pathogens antibiogram. The isolated organisms are located on the y-axis, and the various antibiotics are listed along the top. There's three different colors: green, yellow, and red, and these correspond to the number of isolates that are susceptible to the antibiotic indicated. Green indicates that these antibiotics would be a good choice for empiric therapy because 90 to 100% of isolates are susceptible. Yellow indicates that 51 to 89% of isolates are susceptible, so these antibiotics would be an intermediate choice. Red means that those antibiotics would be poor choices, either because 50% or less of isolates are susceptible to the antibiotic, or the organism is inherently resistant to the antibiotic. As indicated by the gray boxes, it's important to note that the organisms were not tested against all the antibiotics listed. More information about antimicrobial resistance and utilization can be found on the BC Centre for Disease Control's website. They have a couple useful dashboards: the Antimicrobial Resistance Dashboard and the Antimicrobial Utilization Dashboard. The BC CDC's Antimicrobial Resistance Dashboard shows trends in the resistance of organisms to antibiotics in BC over the last 8 years. In the upper display, the bacterial organisms are listed on the y-axis and the antibiotics are listed across the top. When you click on an antibiotic or on an organism, the line graph below will show you whether resistance is increasing or decreasing. The bar graph on the right has the patient's age on the y-axis and shows the resistance in male and female patients. The BC CDC's Antimicrobial Utilization Dashboard shows data on antibiotic utilization in British Columbia for the past 2 decades. You're able to select an antibiotic, a diagnosis, and a health region in BC, and the line graph will show the total number of prescriptions every year. The lower bar graph has the patient's age on the y-axis and shows the number of prescriptions that are written for male and female patients. One interesting website that looks at antimicrobial resistance across Canada is the Canadian Antimicrobial Resistance Alliance, or CARA. When you go to this site, you can choose to look at antibiotic susceptibility for various gram-positive and gram-negative bacteria in various regions across Canada: the Maritimes, Ontario, Quebec, Western Canada, or even nationally, and compare it to other regions. In this example, I've chosen to take a look at strep pneumo's antibiotic susceptibility in Western Canada and compare it to national results. In summary, work collaboratively with pharmacists and other healthcare professionals. Knowledge of pharmacare can help your patients overcome barriers to medication costs. Be sure to prescribe medications using best practices, and also access the provincial academic detailing service and antibiograms to keep up to date. Thank you very much for watching. I'll leave you with my favorite view of the Pharmaceutical Sciences building at the UBC Point Grey campus. If you have any questions, please don't hesitate to email me.